take this wonderful session, I would like to do the honor to invite Dr. Teng. Ladies and gentlemen here on the stage, please put your hands together for Dr. Patana Teng. Well, he is a well-known speaker on the subject of nutraceutical supplements, stem cell biology, and anti-aging medicine, and currently he serves as a Dean of College of Integrative Medicine and Assistant Professor of the Anti-Aging and Regenerative Program. Please put your hands together for the gentleman, everyone.
You see these two apples. The new one is fresh and white, and the old one turned brown. We are just like these two apples. Look at the fresh, young face here. You are the new apple. Someone like me, the brown apple. Lenny, actually, is my friend, so I call him Lenny. I'll ask you, anyone want to be ageless? And you raise your hand. But actually, the fact is why you want to be ageless. Because you don't want to get sick. Age comes with sickness. And this is what happened. Cardiovascular disease, diabetes, hypertension, some of you already have. Sarcopenia, osteoporosis, and cancer. You don't want any of this. Of course, dying is inevitable. Me too. But you want to stay as healthy as long as possible, right? We call it health span. We want health span. We don't want a lifespan. What's the point of living long, but you have to stay being a cripple in your bed for the last 10 years of your life? And that's why we need something called biohacking. We believe that aging is programmed. It's in our genes, it's from the environment, but we are scientists. We have to know the way to prevent and slow down. But first, it's scientific. It's not a horse. It's not a religious belief. It has to be science. It has to be scientific knowledge. And it requires scientific principles. Besides, it's a lifelong process. So it has to be safe and inexpensive. If someone offers you and say, pay me ₹1,000,000 once a month and you'll be ageless, you can never afford it, so forget it. If it's too expensive, you can afford it. It's not going to work for you. Or usually they cheat you anyway. Second, it has to be safe. For example, conventional medicine doctors try to tell you, oh, everyone in this room must have LDL cholesterol less than 100 and you become ageless. Really? Did they tell you that statin can cause coronary artery calcify? So it means it increases plaque in your heart? And it can cause kidney damage and liver damage. You want to be ageless by taking this kind of medicine for the rest of your life? Guarantee you will not have health span. You may have lifespan in your bed or receiving dialysis treatment for the rest of your pathetic lifespan that you have. So, to do biohacking, you want health span, not lifespan. It has to be reasonable price. It has to be scientific. It cannot have long-term complications and need one lifespan to do it. And finally, if you don't believe it, don't do it. Don't believe it. If you don't do it, you just listen and keep talking. Oh, you should exercise, but you yourself never did. It's useless. And it's not easy. These two guys, they choose different lifestyles, so they look different. It's not easy, and myself, I'm older than these two guys. I am 62 years old, so I know how tough it is to stay young and look young. I cannot eat much. I have to exercise. I cannot eat and I have to exercise. I have to be stress-free. I cannot eat and exercise. How can I be stress-free? Life is tough, sir. Life is tough. You know, it's difficult when I give lectures and I have to tear and show you my birth certificate every single time. You want to do that? Of course not. But I think I get your attention now, right? How did I do it? So first of all, it's scientific. You owe because of these 6 factors that I created to tell you. Oxidative stress, sugar toxin, inflammation, the toxin itself that Dr. Costa hopefully is getting better, stress, acidosis. The healthier your lifestyle is, the greater health span you will have. So it starts with you, not me, not your doctor, you. The more you did, the better you get. We have scientific terms here, but don't worry, I make it easy. The first term is oxidative stress. Oxidative stress make you old. Oh, what is oxidative stress? Remember the apple? The new one is white. The one that exposed to the air is brown. That's oxidative stress. Look at the iron. The new iron is shiny. The old iron is rusty. Rust is the oxidative stress of the iron. Now you understand why we are getting old. Because we get oxidative stress, okay? And then it causes our organelle, something called mitochondria, it's a power plant in our body, to decay. So how can we slow it down? We cannot stop it, we can slow it down by eating less. Eat less make you live longer. Anytime you eat high calories, it will metabolize and it make oxidative stress. So chant with me, eat less, live longer. Please, now, eat less, live longer. Again, please, eat less, live longer. That's you have to remember, okay? That's the first rule of biohacking. But to make it easy, because sometimes you eat too much, what you're going to do? Skip the next meal. We call fasting intermittently. You don't have to do it every day, but you do it as often as you can. The basic is to eat for the 8-hour windows and stop eating for 16-hour window. During you stop eating, it's not like a Ramadan. You can drink water, we encourage you to do. But you cannot eat anything containing calories. Peanut count as 1 meal, fruit count as 1 meal, milk count as 1 meal. Nothing with calories for 16 hours a day. You don't have to do it every day, but do it as many days as possible. You can skip breakfast, you can skip dinner, it's up to you. So the second one to make you eat less, live longer, easier is called IF, intermittent fasting. I tell my patients to do it and everyone can do it. For example, I will ask them, what time you have your breakfast?
Normally 10 o'clock.
10 o'clock. So 10 plus S is 18. Please don't have anything to eat after 6 p.m. That's it. Very easy, right? Talk about oxidative stress. You guys think about antioxidant. Don't let anyone fool you that, oh, we sell you the best antioxidant in the world. Actually, the best antioxidants come from your colorful food. Eat your colorful food, but if you take a supplement, that is fine with me. There's no one single antioxidant is better than others. We have many kinds. You have to take everything. Each antioxidant work differently. Carotene, vitamin E, CoQ10, all of them are good. This is my motto here. Anytime you hear Dr. Patana lecture, you have to tell me, sugar is toxin. Okay, sugar is toxin. We talk about simple sugar. So cut down your sweetness. Again, sugar is. Thank you. Now you know why your husband calls you sugar, right? And this is not food. This is junk. This is toxin. We call ultra-processed food. So if you serve yourself breakfast like this, you will get old. It's not biohacking. It's called hack. Unfortunately, this is a country of milk and dairy product, and milk contains sugar called lactose. 1 glass of milk has sugar as much as half glass of soft drink called lactose. So if you want to add milk in your food, in your diet, that is fine with me, but minimize it. Because first, milk contains calories, that is called sugar. And the second, actually the oil in milk causes omega-6 that cause inflammation, and milk also acidic. So milk is fine. Just put it in your coffee, put it in your food, that is fine. But if you drink milk once a day, you will not biohack yourself. Actually, you're going to be super hacking, aging. So understand that milk contains calories and sugar, and eat less, live longer. If you drink 1 glass of milk, you don't drink less, you drink a lot. So choose carbohydrate with high fibers, such as seeds and grains, plenty in this country. It contains omega-9, it contains micronutrients, it contains high fibers, low down sugar absorption. The other things that cause aging is something called inflammation. Everyone knows inflammation. Anyone has gout, pain, swollen, tenderness, that's inflammation. When you have some lady in this room have this aesthetic procedure and your face turn red and swollen, that's inflammation, the one you need, right? But inside the body, we have painless inflammation happen all the time. This is the true cause of heart disease, cancer, and Dr. never told you. First of all, obesity, the fat cells inside your body, inside your stomach, visceral fat cause inflammation. So you have to get rid of these fat. Unfortunately, by the first rule, eat less, live longer. And second rule, sugar is toxin. Okay, now I said tell you how to do biohack. But the next thing to biohack thing that you will hate, I hate it. It's called exercise. I hate exercise. But, I have to be a supermodel of anti-aging. I have to be ageless, so I have to do exercise. Actually, I just won the planking contest in my small fitness club, and I won because I can do planking for 8 minutes with screaming and screaming, 8 minutes. And they were surprised that the guy who win is only 62 years old. Not only I win, but I won, and I'm much older than all of them. So exercise is tough. But, you save money in your bank, right? Because you want future, right? Exercise is kind of thing you save for your own muscle in the future. Think like this. I don't care, unless you're sick and you die lying on your bed and crippled. Everyone in this room must have time for exercise. You can say, I don't have time. If you have time to eat, if you have time to go to the toilet, if you have time to work, you have time for exercise. People who don't have time for exercise will need more time for sickness. So I set up my time. Like I have a schedule at the hospital, I schedule the clinic, I'm a dean, so I have a schedule here and there. And every week, twice a week, I will have a schedule for this is my exercise time. Don't take it away. This is my exercise time. I have my personal trainer. When it's time, I can do exercise. Yes, we can switch and change the date and time, but I must have exercise time, just like working, just like saving money, because that's saving of my health span. Do that. And lady, don't tell me shopping is exercise. Shopping is shopping. Inflammatory diet, anti-inflammatory diet. Very simple. Oh, you want blue zone diet? Oh, you have to hire a special chef. Actually, you can buy bottles of olive oil. Everyone knows olive oil. Okay, that's it. That's the blue zone diet. Pour in your everything, it will reduce inflammation, and take fish oil if you must, especially someone of you who are vegetarian. Okay, so you need to do some flaxseed oil or anything that contains omega-3. For vegetarian in this room, olive oil is a must because it contains omega-9 to reduce inflammation. Unfortunately, Dr. Lenny just exposed himself to the toxin. I understand why, because I was sitting here and standing here, I'm just about choking as well. So you are next. Because some PM 2.5 in the air. So we have to avoid it. Unfortunately, we keep producing it. But the body have the way to detoxify. Start by avoid toxin in the body and try to detox yourself. Drinking water is good, is one way to do it. Okay, 5 times to get out of this PM toxin and live in the mountain and breathe fresh air sometimes. There's a lot of principle of detoxification that you must know. But anyway, one thing that I like to tell you, oh, by the way, don't worry about the slides. Only thing you know is my name. My name is Dr. Patana, P-A-T-A-N-A. And the second thing you need to know is www.heatantiaging.com. That's the only thing you have to write down. And then you check the website, heatantiaging.com. Send them information that you want Dr. Patana presentation today. Someone will send to you, to your email. That's easy, right? So don't worry about the presentation. Just remember what I tell you, like sugar is what your husband call you, for example. Dr. Sudita is going to tell you about these good bacteria in your guts and you keep destroying it. It's the one who try to keep you safe. Why you hate it so much, you have to kill your own bacteria. For example, you eat clean, super clean food, overcooked food, and you take antibiotics, antiseptics. Good bacteria inside your body is good for you. Dr. Sudita is going to tell you that, including probiotic supplements. But the one of the toxin that you don't know is called drugs, allopathic drugs. Believe me, pharmaceutical companies, they're not going to, they say, oh, this drug is good for your good health. They say that because they want their own good wealth. They don't care about your good health. They want their wealth. And they give shit about your health. Because healthy people will not take drug. So statin entire life, proton pump inhibitor entire life, forget it. Dr. Patana not going to do it. It's a difficult journey for me because I'm a doctor. I have to fight against conventional medicine where I'm still working. But I'm been doing this for 17 years. And I think the one that I can win is my patient because they know what I do for them. They're getting better. I'm going to show you pictures at the end. One of the other drugs that I hate, proton pump inhibitors. Make it simple. It inhibits proton pump. And your body needs proton pump. It's like you use antibiotic to kill your own bacteria, and now you use drug to kill your own proton pump. What's the proton pump do? It's prevent your body from acidosis. Anytime you eat your food, it metabolizes, you create proton, acid. You're taking drug, you create acid, proton. You're drinking milk, you create acid. You eat food, you have acid. And the body working so hard, the blood, the red cells, the kidney have to excrete proton, acid out in the urine. And suddenly you take proton pump because you don't want the acid to come out from your stomach. The entire body is so corrupted. This is not body hacking. This is murdering. You kill your own proton pump so the body cannot get rid of acid. The result, these organs fail. Proton pump inhibitor is the most common cause of cancer nowadays, osteoporosis, weak bones, and kidney failure, the study proved. And the doctors still say you have to take proton pump for the rest of your life. Anyone in this room have a stomach ache? Go for Ayurveda medicine. I don't know how to call gooseberry, perhaps. What?
Ayurvedic medicine.
Okay, so what's the name of the Ayurvedic medicine that you use if you heartburn?
So I use home remedies.
What inside? Okay, maybe gooseberries, I don't remember. But anyway, go for your Ayurvedic medicine. Say no to proton pump inhibitor, PPI. Okay, otherwise you may have kidney failure and osteoporosis. There's a one wonderful longevity medicine supplement. It should be happen in your house. It's called baking soda. Anyone in this room ever drink baking soda? Drink it every day. You live long because that's the way to help body get rid of acid. I give you the cheapest, simplest in the kitchen blue zone supplement for your longevity, and it costs almost nothing. You can do a lifelong baking soda. talk about longevity medicine, some company would try to sell you magic pills. These pills cost you 40,000 rupees a month. Can you afford it? But it will increase telomere length, blah, blah. You don't understand what does it mean. But then, well, it looks wonderful, right, as you start taking it. So it needs scientific, remember, process. It cannot be too expensive because you have to take it for life and it cannot have any side effect. Remember this rule. But before you take longevity pills actually come from your food. Food is your medicine, and you need food with micronutrients like this. My favorite one is vitamin D3, very cheap. Don't expect you get it from the sun. We don't barely have any vitamin D can get through PM, through the sun. Take supplements such as vitamin D3, carotenoids such as astaxanthin. So micronutrients come first before you go for any longevity pills. I do take longevity pills. Right now, longevity pills in terms of scientists, they divide in two groups. One is called caloric restriction mimetics. Remember, eat less, live longer. But I already ate. You have any pills that to fool my body haven't eaten anything at all? Yes, it has something called caloric restriction mimetics. And the other group is called senolytic or kill zombie cell, which I'm going to explain. Resveratrol is the most common one that we use as the caloric restriction mimetics because it enhances good genes that make you look younger and inhibit the bad genes that cause inflammation. So resveratrol is the one I take almost every day. Urolithin B, okay, why to get urolithin B, you take this pomegranate and then mix it with your bacteria in your gut. Has to be pomegranate seed, not juice. And then the gut bacteria will make urolithin B for you. Simple. Food is your medicine. Okay? What is zombie cell? You know, when you're getting old, your cells, sometimes it not die, but it's not working. It's staying there like the aging politicians in your country, taking money and doing nothing, like zombie cells. So you have zombie politicians everywhere, my country included. What happens if you can get rid of these zombie politicians? Then the new flood of younger generation active people can work, right? So right now we have medicine to get rid of zombie cells. So scientists far advanced, we can get rid of your zombie cell. Why we cannot get rid of these zombie politicians? But start with simple lifestyle. Simple lifestyle, good lifestyle can prevent zombie cells. Reduce stress, good micronutrients, vitamin D3, fish oil, and good night sleep. But nowadays, the studies show that in mice, if you can get rid of these zombie cells, these old mice will be young again. So that's the hope for Alzheimer's and kidney disease. And there's 2-3 drugs that are very famous. The one that you know quite well is called curcumin. I'm kind of allergic to sulfur in curcumin, so I take fisetin and quercetin instead. The last thing is about stem cells, which is not my topic today. When the effects of the aging forces happen to the cells, not only regular cells, but every cell, including the young cells that called stem cells. So, there are many ways to improve your own stem cells. But one thing, I'm not talking about inject stem cell. I'm talking about hormone. When times come, you will need hormone. Someone like me, a man, 62 years old, I need my testosterone. Don't take away my testosterone. At your age, for ladies, you need estrogen, you need progesterone. So when times come, you need your hormone. Hormone is wonderful to prevent aging. If you use this right, it will not cause cancer. But if you use it wrong, yes, it may cause cancer. So, in conclusion, biohacking, you want to stay young because you want to stay healthy, you want to have good health span. Eat less, live longer. Remember intermittent fasting. Cut down sugar. Dairy product and milk contain sugar. How many hours I sleep at night depends on who you are. Myself, I want 9 hours, but I can do only 7 because that's my time limited. But if you have a good, very deep and fresh, when you wake up, some people 6 hours is enough. So 6 to 9 hours depends on people. Okay, good night sleep is part of the biohacking. If you cannot sleep, you will have a low immunity. Exercise, detoxification, supplement hormones when you need it, and reduce stress. What you should not do, eating without thinking what inside the food you eat. Just because it's delicious, it doesn't mean it's good for you. Never find time for exercise. And taking medicine because the conventional doctor say it's good for your heart, but it may be bad for your health. Don't do that. More vaccination, oh please, stop influenza vaccine, it never help, and COVID vaccination. Unsafe medical practice, and for some of you, want to sell the magic pills, but actually you don't know the mechanism of it, you want to make money of it, you have to prove to them. I can sell anything. People come to me in Thailand because I'm the model of Ageless, but I don't. I say without scientific reason, I would not do, because my name depends on it. Anything I do, I sell, I have to take it. I take statin, I have side effect. I take diabetic pill, I have side effect. I have every pill. I try every pill in the world that they claim is good and has side effect. You want to get old, but you need to be happy. You want to be grumpy old man. Happy older, live longer. So I think I can tell you now that biohacking is not a dream. Anti-aging is not a far-fetched, but you have to believe. You have to do. It's a lifelong process, because the best doctor is yourself. And if you don't find time for your wellness, you're going to need time for your sickness. Wealth is nothing without your good health. I know some things I tell you may be something new. Someone will be shocked. But believe me, if you don't try to do something different, think outside the box, miracle will not happen. This lady, she's 94 years old. She came to see me 16 years ago, almost died because of drug complication, pancytopenia infection. After I treat her, I said, stop all the drug. You don't need those, and take supplements. Of course, I cannot help her to look younger, because by the time she saw me, she's already almost 80 years old. But she never spent the last 15 years any single day in the hospital. She knows one day she will pass away by going to bed and will wake up. And that's what a happy way of living this world. Hope you have the ageless and health span. Thank you so much. ขอบคุณมากครับ